I moved it that way. Backwards.
Where someone got the COVID-19 and who they have spread it to. And then we follow up with each of their contacts by phone to give their contacts instructions about how not to spread it further. We track COVID-19 data to anticipate the work ahead and the resources required and how we can stop the spread. We also work to protect vulnerable communities in higher risk settings, such as those who are homeless or those living in congregate living settings. We try and provide leadership advice. And over the past 2 months, we've produced dozens of guidance documents to support our partners within the municipal, nonprofit, public, and commercial sectors as we all learn to function within this pandemic. And we try and provide public education in the form of radio public service announcements, media interviews, social media content, print advertising, and website content. And we try and provide credible, accessible, easy to understand information every day to the entire region. And these efforts, fortunately, have been working because we've had citizens who've been very cooperative. So far, we've had a little over 70 cases, and we've flattened the curve significantly. And at the moment, we only have 6 active cases, and our doubling time, or the time it takes to get twice as many cases, is over a month. So that's quite a flat curve. The Ontario government has started its reopening strategy, and we're all quite pleased about that and happy to start to get outside of our home. And our hope is that the cautious and measured approach in reopening will not see a big spike in cases. Just to understand, we will probably see more cases because we are lowering, our guard against transmission by letting people be more together as we reopen. But we do hope that we all do this reopening safely, both the businesses and their community members, and so that we may only keep that curve flat as opposed to getting a spike. Because we don't want to see a spike in cases that'll send us backwards, and then we'll have to close everything up again. So your participation as businesses is key in this reopening, not only in terms of keeping the curve flat, but also as playing a role model to our citizens in how to develop a COVID defensive culture. So one point I do want to note, though, is that we've observed quite a bit of confusion about the role of public health related to workplaces and the role of the Ministry of Labor. And that's understandable. So to reduce confusion and frustration, while we continue to advise workplaces about infection prevention and control measures and we hope to work with you closely to increase your understanding and capacity on infection prevention and control. We'll also outline what the Ministry of Labor does. And what they do is they investigate workplace hazard complaints, including those about communicable diseases like COVID-19. They also have the authority to issue stop work orders if they determine that there's a risk to employees at the workplace. And they determine whether a hazard is adequately controlled or whether a workplace needs to be closed. I understand that we have time for questions at the end of the presentation. I will now direct your attention to my colleague, Kayla Elms, who is one of our public health inspectors here at Southwestern Public Health, and she's going to go into some more details. Kayla?
Perfect. Thank you so much for the introduction, Dr. Lock. So like Dr. Lock said, my name is Kayla Elms. I am a public health inspector here at Southwestern Public Health. Some of you in the capacity of your businesses may be familiar with our public health inspectors. Prior to being in the pandemic, we were working with businesses where we have regulatory authority for the control of any kind of health hazards or disease in the community. So mainly where you see us is in restaurants, grocery stores, pools, hair salons, nail salons, tattoo shops, hospitals, long-term care homes. But through our role outside of the pandemic, it seemed pretty appropriate to have health inspectors play a role as well with the opening of businesses, since we're pretty familiar with giving infection control advice to businesses. So that's how I got involved in this role here. So here at Southwestern Public Health, we've worked to develop a pretty simplified yet thorough guideline on COVID-19 and the role of reopening your workplaces. We noticed we were getting a lot of questions as the government was starting to reopen about infection control, how they can reopen safely, how to reduce spread of COVID-19 in the community. So I will direct you guys, if you can, to head on to our website. We do have a section of our website now specifically to workplaces and employers. That's a really great resource for reopening your businesses. And we also have a guide that we finalized that is specific to reopening businesses. So this includes information about designing workflows, one-directional movement, curbside pickup and delivery options. I've simplified some stuff on PPE that's most commonly requested by businesses, being masks and gloves. I'm not going to get too much into that section today because we're lucky enough to have Colin on the call who will cover the PPE section for you guys. And then just about disinfecting common surfaces that are in a business. So we have specific guidance for whether it's high touch surfaces, upholstery, electronics, and then how to work through a plan for reopening. So my recommendation when you're reopening, and I imagine some of you are already taking these steps since the phase 1 opened a couple weeks ago now, is starting with a plan. What do you need to do prior to opening? What do you need to disinfect? How often do you need to disinfect it? So with high touch surfaces, every 2 hours, depending on what some of the surfaces are in your business, you might decide on a morning and afternoon schedule, what needs to happen daily. And then from there, going into what supplies you need. So common household cleaners are effective in killing the COVID-19 virus. So making sure that all of your cleaners and disinfectants have not expired. Make sure you're taking a look on the back on the manufacturer's directions. It'll give you some directions about how to use specific cleaners, making sure you're not mixing any cleaners. and making sure as well that all your cleaners have a drug identification number or a DIN. This number is a number that Health Canada puts on all products approved for its intended use in Canada. So in layman's terms, Health Canada knows that that product does what it says it does. So if it says right on the label it'll kill 99.9% of germs, Health Canada has confirmed that that is exactly what that product does. So making sure you have a DIN or an NPN number for natural products. And then getting yourself ready with what PPE do you need, how to communicate to your staff, your policies as you go ahead, how do you communicate to your to the public what you've got going on, making sure you're ready for some of your employees who may be calling in sick, and giving them a bit more flexibility with calling in sick, making sure employees do stay home while they are ill to reduce the spread in our community and as well as in your workplace. And then most importantly, making sure that even though the government is doing these phased approaches and Premium Forward is allowing some of these businesses to reopen, don't open until you're ready. There would be a firm date when you can reopen, but until you've done everything you need on your back end, you've got a plan for reopening, you've got your plan for how to do that curbside pickup or the one directional flow within your store, making sure you plan to have that 4 square meters or 43 square feet of retail space per person so you can get that social distancing inside your facility, ticking off all those boxes, and then opening when you're comfortable and when you're ready to the public, when you're ready to go there, so that you're not feeling rushed and you're not feeling like you're not prepared to go. While I'm on the call here as well, I'm like Dr. Lock said, there's a bit of a difference in what public health does and what occupational health does. So I wanted to point all of you in the direction of the Canadian Centre for Occupational Health and Safety. We do have a link to these resources as well on our website under that workplace and employers page. So it's really great when you go to swpublichealth.ca, right on our front page, there's that section for workplaces and employers. You can't miss it. And then this Canadian Centers for Occupational Health and Safety has come up with these sector-specific guidelines. So I think the last time I checked, there was more than 90 of them now. So they range from if you do a retail business, if you've got a restaurant, if you have a hair salon, if you're in an office setting, what recommendations for infection control would apply to you and your staff to keep them safe, and how interacting with the clients you can minimize the risk there as well for transmission. And then lastly, just covering, I guess, some examples in the community where I'm really lucky to be able to work very closely with some business operators. Some of the examples I might give you just where I work very closely with food service are going to lean that way today. And where they might have a bit of a higher standard to meet because they're not opening fully. And they have a regulatory requirement to meet some standards with the public health inspectors. But an example, I've been working really closely in Central Elgin with a farmer's market that's hoping to open, and they're actually opening up tomorrow. It's been a bit of a scramble because they decided they were going to open in place of a farmer's market that couldn't operate and was closing. So for farmers market, they had to meet very strict guidelines where they can only provide food and food for takeout. So the normal stands at a farmers market that might have flowers and soap are currently not able to operate under the provincial guidelines. We've developed very specific plans for them to open. So this specific market has an entrance on one side, one directional flow going all the way through the market. There's options for some of them to pre-order in advance, so there's no crowding where they might be browsing for product. Really the intention is to come, get, and leave. I've worked with them to get hand sanitizing and hand washing stations, to have screening tools in place for not only all of the market vendors who are coming to the market every week, but also for the public who are coming and shopping. 2-meter distancing. We've got them spray painting and taping 2-meter distance on the ground to keep everyone spread out. I've worked with them about the best ways to pick up their food where they can still practice those 2 meters distance, so that there's not so much distance between folks when they're ordering and when they're picking up their items. So that was a really, really great experience. It was a really lengthy experience because I was dealing with 15, 16, 17, 18 vendors plus the organizer itself. Another really great example in the community was a local ice cream store where they, even outside of COVID, are familiar with having very long lineups outside that then queue inside as well. So with them, we worked on, again, having a one direction movement through their facility. They actually installed another door so they could have an entrance and an exit. They put pickup windows to the outside of their facility as well, so folks don't even have to come inside. They can just come, order, and leave. Again, screening tools, 2 meters distance, hand sanitizer. We put in a plan in place with them, only having one person from a family go in to take their order so that you don't have crowds of people gathering indoors. So it's been a really great experience working with members of the community. And then lastly as well, how can you share this information with your customers, with your clients, so that they have confidence in what you're doing? It'll help your business thrive, but it'll also help normalizing this idea that we're still in the middle of a pandemic. So some examples of what you can do, just let the public know that you've been working with the health unit and that you're taking that health advice and that you're ready to open under the pandemic. Post some of those steps you've taken for the public to see on your Facebook page, on your social media sites, local radio and newspapers, putting some of the Southwestern Public Health signage out on your front window to let them know what your procedures are, how many people can come inside, what they need to do if they're going to be coming in, working with them as well to keep those 2 meter distance as possible. Mailing out letters or sending emails to your most loyal customers is a really great example. Just giving them 3 to 5 bullet pieces of some really great stuff, new stuff you've put in place to keep them safe, and that way they can have confidence in you as well. And then again, thanking your customers for their loyalty, their patience with your reopening measures, whether it be in a newspaper or social media, just to let them know that you're engaged, you're involved, and you're working really hard to limit the spread of COVID-19 in the community are really great ways to get your message out. And then again, I guess I'll answer some questions over at the end there, but for now I'd like to turn your attention over to Colin, Mr. Colin Cook. He is our guy who does everything PPE right now. And Colin, I will hand it off to you on how to get PPE and how to use it during the pandemic response here.
Thank you, Kayla. So as I mentioned earlier, I am a dental hygienist, so I've been using PPE, and if, you know, prior to COVID, you might never have heard of PPE, and I think everybody is well aware it's personal protective equipment, and in one way or another, I've been wearing or utilizing PPE for a long time, but even us, we have changes coming down, guidance from the ministry with regards to dental offices, and so I'm under all kinds of change as well. So I can relate and sympathize what you're going through. All this new PPE, it can create a little bit of anxiety of where to get it and how to get it, when to use it and how to use it properly. So we're here to mitigate those concerns and hopefully provide you with some great resources and information on how to go about doing both of those. So first, just give you a little background on what we've been doing. Myself and Nicole are part of the PPE team, and our job has been to develop those guidance documents that Dr. Lock referred to at the beginning. Those guidance documents are to help both the public and healthcare settings. We're hoping to be in alignment with what the Ontario guidance documents are stating, but as you well know, and as Kayla mentioned, they're coming out so rapid as things open up. We're seeing more and more every day. So we've been really lucky to be in touch with a lot of amazing people from our region that we've been able to rack their brains and get all kinds of information. And from that, we've been able to, one of the opportunities was to develop an alternative PPE list that we created. So we took a bunch of companies that have come from all over and consolidated a list that we've made available through to Elgin and Oxford counties to all of you, and I'll talk a little more about that in a few minutes. And just as a team, every day we're striving to help the community with those best practices. So how to use that properly, and ultimately how to conserve it as well. There is a limit to what's available out there, and we want to make sure that it's being used correctly and through conservation. As far as COVID, you may or may not know, it is spread through droplets. So it, from coughing or sneezing or being close to somebody in close proximity. Kayla mentioned about the 4 square meters. That's fantastic. If your business is able to accommodate 4 square meters, you want to make sure that your customers and your employees and yourselves are not at risk. So always assess your risk with regards to what PPE or masks or what you may need. So there's masks, gloves, those would be the most common for I think for what you would need. As well, you may need, depending on your type of business, gowns, plexiglass rather, shields or barriers, graphics, signs, things like that. Always dependent on the level of risk that you and your customers or clients will be in. In a situation where you're around, maybe you've screened them and they're a probable or a possible case of COVID, then absolutely PPE is required. But more importantly, you want to maintain frequent hand washing. I think we've all heard enough about proper hand washing and use of alcohol-based hand rubs with 70% alcohol. So we're always trying to promote those other types of preventative measures, maintaining that distancing. That you can't stress that enough. But if you do need to use that PPE, if you do need to wear a mask due to the fact that you can't maintain that 2 meter distance, then there are some things you need to be aware of. First of all, if you're donning a mask or putting on a mask, you want to make sure that you're not touching your face. You want to make sure your hands are clean prior to putting it on and taking it off. The risk is that the mask doesn't always protect you if you're not using the proper techniques, and then you're risking that you're going to contaminate the outside of the mask, and thus you can contaminate other things, or you can put yourself at risk. I'll talk a little bit more about that in a few minutes. You're probably wondering, well, where can I get this PPE? How do I access it? The nice thing that, as I mentioned earlier, we're in works with a lot of local providers, and there's several Southern Ontario companies now that are out there that have stepped up to supply or manufacture quality licensed PPE products. And that's the important part. Not unlike the cleaning products, you want to make sure that they're CSA approved. There's been a lot of talk on social media and through internet sites of knockoff masks. Just buyer beware always. So as I mentioned earlier, the PPE products can be anything from masks and gloves to barriers of all shapes and sizes, anything you can pretty much imagine to help with your infection prevention and control needs. When your employees must be well educated. As I referred to earlier, you must be aware of how to properly use it. There's ample videos and links on our webpage on how to properly put on or don and take off or doff a mask, as well as the hand washing and glove use and things like that. So feel free to access our website for those links. Also, you have to remember that it's not just about when you're using the PPE, but when you're disposing of it. Make sure that you're getting rid of that in a safe manner that's not going to put yourselves, your employees, or your clients at risk. You want to make sure that when it's removed, you're putting it into a closed bin with a plastic bag that can be tied up and put away so that no one will be exposed to that. And that will reduce the risk. There's been all kinds of in the beginning stage when PPE was kind of recommended and there wasn't a lot of information out there showing people manufacturing or making their own masks. And I think now we're at a point where the cloth mask seems to be the norm, and most people are aware of how to properly take care of it and clean it and such. If you're using PPE, there is a risk again that you can be exposing yourself rather than lowering your risks. So again, refer to our website and the links there that for any information on properly care for and take and remove and put on PPE. So where do we get the PPE? The list that I was referring to, we call that the alternative PPE suppliers list, and we update that weekly. So word of mouth has been fantastic. Originally, I was receiving information from Paul Jenkins from the St. Thomas and District Chamber of Commerce. Now I'm getting a lot more emails from providers, and then we can update that list usually by every Friday. We update that, we make that available. It is on our website in that workplace and employers update link. And as well, I can make that list available to you, Kim, and other chamber members. Once that is done, I have some new ones to add this Friday, and then I'll update that and get that out. Those lists, they basically include company names, contact information, so a contact person, phone number, email, and also on the far right column, they include what those companies are providing. It's a very detailed list. So if you're looking for something specific, then that's the way you go about it. You can just refer on down that right side of the list and contact the supplier as per your needs. So for instance, if you needed some floor graphics, for instance, the right side will say which companies rather have those floor graphics available. You can just cross-reference it with the company name, give that person a call, and you'll be able to acquire that product. There's a lot of questions around whether or not the customers themselves need to wear masks. The Ontario government and the federal government, and of course Southwestern Public Health, does promote and encourage and recommend use of masking. So masks from client or for your customers, and masks for your employees if they can't maintain the 6 feet or 2 meter distancing. Because it's not mandatory, you could have a policy that does suggest that customers do need to wear masks when they come to business. If you do implement a policy around those, we do recommend that you utilize your social media accounts and put up signage around your business to inform your clients and or your customers for your up-to-date policy. That way they'll be aware before they come in or when they arrive at your business of what your policy is regarding masking. We also recommend, depending on your type of business, if you're having clients call in for appointments or if you're having clients arrive right at your business, that you perform or do a passive screening or an active screening, so you can address your clients and ask them whether or not they're having symptoms, and then that will determine the risk of whether or not you want to have those clients coming into your business as well. And you can become an educator for your customers as well. You can mention that they should be doing self-assessment and making sure that if they are having symptoms or feeling sick, that they shouldn't be coming to your business at all. And alternatively, you can also offer curbside pickup and delivery. Those options have been available for a lot of the essential services already. So as your business is open, you might have the opportunity to employ those to limit the foot traffic in your business. As far as your staff, should your staff be wearing masks? Again, universal masking is not mandatory at this time, but highly recommended. Your staff should be performing a self-assessment as well before they come into work, as well as you should. And again, if you're feeling any of those symptoms, then you should hesitate to go. Depending on the setting and situation, PPE may be required. We talked a little bit about the maintaining your social distancing. Depending on the type of business, if you're an outdoor business or a factory or warehousing, it would be a lot more likely you could maintain social distancing there. But again, wherever there's an area where there's going to be people in close contact, we do recommend use of mask. On that note, there's discussion about whether or not medical masks or cloth masks should be used. We are recommending cloth masks for the public. The medical PPE should be reserved for healthcare settings, if at all possible. Through the alternative PPE, you'll be able to purchase the medical type masking and gloves, and that's fine because those are alternative sites, but we do have hubs and such that are reserved for medical purposes. I guess that's pretty much all I have with regards to the PPE use and safety. If there's any specific questions, I'd be happy to answer those.
Thank you very much, Colin. We do have some questions, so I don't know if they're specifically for you, so let's just start with Suzanne from Tillsonburg. This, I think, is for Kayla. She would like some verification on the DIN or VIN for natural cleaning products.
Yeah, Kayla, it's Suzanne. I think I missed part of what you said. You were going through the cleaning products and, you know, what was required in them and that sort of thing, and the standard that Canada has. But did you also say cleaning and sanitization products that were natural?
Yeah, so there's some products that any product that might have a claim that they are a natural product. Where the DIN on your household products like your Lysols and your bleaches, that one's a drug identification number.
Mm-hmm.
On a natural product number, there would be an NPN, a natural product number. And it's the same thing. It just means that Health Canada's verified that product does fulfill the claims that are on the label. And then, of course, just making sure that you're following the manufacturer's directions on the back there as well, as far as how you mix it, contact times, to make sure that you are actually getting out of the product what it's intended to do.
Okay, thank you very much.
Okay, next, Judith had a question for Kayla as well. She actually hope you can send the protocol to her for the farmers market, because the BIA here in Woodstock has a farmers market every Thursday, and they are not open. They're on hold right now because of trying to follow the proper procedures. Judith, do you want to speak about that a little bit more? Can I unmute you? Yeah. Where is she?
You can hear me?
Yes.
We've received a lot of information about markets, and Peterborough Market is one of the bigger markets and they've sent us their guidelines. So it was recommended that we contact our own Southwestern Board of Health and get some guidelines. So that's kind of why I want to chime in today, because that was going to be my big question, is doing that. So when Kayla said that she'd already set something up with Elgin area, I'm like, oh, this is perfect. Just because we know ours is outdoors, it's open air, but recommendations of hand washing stations, one entrance, one exit. Can you make it flow end to end, or does it need to be you come in the same way you go out? So those are some of the questions that I knew our board would be asking me. So I needed to make sure I did my due diligence and had all this information to present to our board of directors, because it'll be based on what our board of directors want to do with our little BIA market. With the whole no gatherings, and it is downtown, it's open space. We just needed some direction and make sure that we're following the rules.
Sure thing. So we do have a Southwestern Public Health guideline and a protocol for farmers markets as well. It's a summary of what is regulated by the province right now. So right now, only food, whether it's farm stalls or takeout, can operate. You can't sell goods. I think the idea behind that, again, is to limit people sticking around and taking their time and browsing, so you can get that 2 meters and keep the crowds down. But what I'll do is I'll send your information off to our inspector who covers that area in Woodstock. That way you don't just get our protocol, but you've got someone to talk to as your questions come up, who's dedicated just specifically to the Woodstock area, who can answer your questions as they come up as you read that document.
Yeah, I just, when you said it, it's like, oh, you've done the work. You know, let's not try and recreate the wheel if you've already got the wheel going, right? And of course, you know, our market hasn't been that big, but our persons that do sell food have been in touch with us. We already knew we couldn't have artisans selling things. It would have to be only food and fresh vegetables, that sort of product, as well as cooked food. So anyways, that was the big thing about markets. So thank you.
We have a question, another question, and I think Colin somewhat answered this, but Lori Schneider is asking, is it anticipated that businesses are going to be directed to screen clients, customers for temperature, et cetera, before entering?
I don't know if that's an anticipation. We do recommend that employees do a self-assessment, and if you're having clients calling in, perhaps you could do a passive screening. There's a question related to the bottom with regards to, is there a list of those questions? You can access the Google Self-Assessment Ontario or go to the covid-19.ontario.ca site, and it will have, there's a self-assessment there that can be utilized, and those questions are listed there. As far as the temperature, currently that's not a good indicator of COVID, so it's not recommended. There won't be any, I don't believe, and maybe Dr. Lock can speak more to that, but currently I don't believe temperature is one that's being utilized as a symptom.
So this is Dr. Lock. Yeah, I agree with Colin. A lot of places are advocating or instituting temperature checks. I have to do a little bit more digging as to what the root of that is, but temperature checks have been shown to be not a very valid indicator. You could be afebrile when you walk in, like have no fever, when you walk into work, and an hour later have a fever. What we ask people to do is to keep an eye on their symptoms. If they feel unwell, and you know, we're loose with the word unwell. A person knows when they feel unwell. When they feel unwell, they should declare that to their place of employment and exit from work. COVID presents with a whole variety of symptoms. If you look at the possible symptom list, which is on our website, it's quite lengthy. And fever only shows up in a small percentage of the patients. There's a vast majority of people who don't have a fever. So one, it's much more important to develop what I call a culture of COVID defensiveness within your workplace, where each individual internalizes their own responsibility to keep themselves and their colleagues and your customers and clients safe. And so I think people need to self-monitor how they're feeling throughout the day, and then report that and deal with it at any time they start to feel unwell. I know that has an implication for, you know, having your employees sick or not sick and at work or not at work, but I think at this point in time, we'd all be more thankful that someone reported earlier and didn't infect anybody else at work. We do, you know, ask workplaces to consider active screening of their staff when they start work. That means you actually ask them in some way. And that is because all of us have this inner drive to try and please our workplace or to try and shoulder our part of the work job at work. And so that we tend to want to at times ignore milder symptoms and then continue on into work. And we find that over and over again, that ends up being the introduction of the COVID into work. So by asking your staff yourself as an employer, you take that burden off of them in a way from not being the good quality worker that they want to be for you. So yes, you can consider both asking your employees to report anytime during the day that they're sick, and perhaps asking them actually yourself at the beginning of the workday.
Thank you, Dr. Lock. So Julie was wondering, she hears from a lot of people that they don't want to or can't wear a mask. Some say they have difficulty breathing and that you can get ill from wearing a mask. That's from not properly putting it on and taking it off, I guess. Do you have any advice on the importance of wearing a mask and how to address those people that are wearing them? It may be a ministry question, but you may be able to offer some alternatives.
So recently I was collaborating with some colleagues on a guidance document for vulnerable populations. And that included those who couldn't wear a mask due to asthma or anxieties, things like that. First and foremost, children under the age of 2 and under, and also anyone that's able to remove their mask by themselves, it's asked that they do not wear masks. As far as refusing or declining to wear a mask due to health or any other reason, again, universal masking is mandatory. It's recommended. And in a situation where perhaps you have somebody who's declared that they're unable to wear a mask, perhaps those other business practices such as curbside pickup or delivery would work for those individuals at this time. The mask itself we're going by the premise that I wear a mask to protect you and you wear a mask to protect me. So by putting a mask on, you're preventing your droplets from landing on surfaces or being in the space of other people and reducing the risk that they're going to got COVID. So as far as the question of that some saying you can get ill from wearing a mask, if you're using it properly and safely, you're not going to be predisposed to it. It's when you touch surfaces and you're adjusting the mask and you're letting it hang off your rear view mirror and you're reusing it or sharing it. Those are the practices that can predispose you or put you at risk for getting ill. But again, the mask, universal masking is recommended for the population because I'm wearing it to protect you and you're wearing it to protect me. I hope that answered the question.
If it didn't, Julie, put up your hand or unmute yourself if you can.
Nope, that's good. Thank you.
Okay. And this one's from Margaret. Do you need to make an appointment for public health to come in and go into our business when we receive the go-ahead to open?
So right now, public health inspector, we don't go into just any business. Again, we have specific regulatory requirements where we inspect businesses that are regulated or do have laws under the province where they need to follow certain rules. Examples, again, food handling pools. Right now, under a pandemic, it's a bit of an interesting situation where we've got folks who are redeployed all over the place, and we're working on our own. We're acquiring our own PPE so we can work safely in the community as well. I can't give you a hard yes or no because it's a bit of it really depends on, like, if you're a retail business, no. If you do have questions about COVID, I would highly recommend just getting a hold of our call center. We have a really great handful of public health nurses who are so well informed on everything that's coming up and can answer some of those questions for you about opening. But if you're not a regulated premises where you don't usually deal with a public health inspector, my short answer would be no.
Okay. Lori has another a question. In a client appointment-based business, should businesses retain the screening documentation for contact tracing needs in the future?
So this is Dr. Lock. It's always helpful for public health to have more information rather than less. So you're asking me, you have your employees come in and then you screen every day. What's probably more important for us is that your workplace knows who was where when. So let's say somebody gets sick and then some of your employees were contacts. We need to know who was on what shift with that index case. And we often need to know not only who was on the shift, but how did they work together. So if they never cross paths, of course, then the contact is a very low risk. If they spent the majority of the day in close contact, then there's a high probability we're going to ask that employee contact to be excluded while we wait to see if that employee gets infections. So I don't know if it's the screening tool as much, but you need to know, you should have an up-to-date list of who your employees are, so that, let's say we need to send out a memo to all of your employees that somebody was sick and they need to watch for symptoms. So then we should be able to have a list of employees. We should have their contact information or their email addresses, so that we can send out this communication to them, and we need to know who was working when and where.
Can I just can I just add something? In addition, with the client appointment-based business, depending on what kind, there may be a regulatory college as well. So if it was a massage therapist, for myself as a dental hygienist, we have guidance from our college. And part of that active screening process is to make a recording. So there may be some guidance from those colleges if it is that type of business. And then there's also guidance as well for follow-up. So if you see a client today, if they are exhibiting any symptoms, they are recommended to report back during that 2-week period if they're, if they fall ill, to let that business know or that individual know, so that they can contact that list, as Dr. Lock mentioned, and then they can follow up. So I'm not sure what kind of client-based business Lori is in, asked the question, but there may be additional guidance documents that are available.
Lori, does that answer your question? I'm going to assume. And Judith has another question. I'm not sure if you can answer this. They're looking to do an outdoor barbecue. Are they allowed? And do they need a food handler's certificate? I'm going to assume so. And it's to feed the homeless, I guess. It's downtown BIA.
I would recommend getting in touch with your area public health inspector. Again, it's not a really cut and dry yes or no answer. Where food provision is an essential service, yes, but you would have to work with your public health inspector, because depending on where it is, how it's executed, you might need to fill out special event notification forms. You might need to keep some records for the food that's being provided. We might have to give you guys some guidance about, again, keeping crowds down and social distancing. So it's a bit more of a lengthy follow-up than I can unfortunately give you on this call. So yeah, if it's going to be the BIA, again, it'll be the same inspector I hand your information off to for the farmers market. So definitely pose that to them as well, and they'll work with you to see what we can and cannot allow, or how we can work with you to find a way to do it in a way that it can go through, and whether it's working with us and your municipality and letting our call center know, just so everyone's kind of on the same page, and we're doing it all from a risk-based standpoint, and that everyone is well informed.
Yeah, I mean, it wasn't at our market. We've had a barbecue that, for instance, fundraiser for, let's say, for cancer. They've had a charity there do a barbecue that they would sell product. So part of that question was about that for the market, if that would be allowed. But then we've been approached by a program within our community that want to offer a barbecue downtown Woodstock on the street and to feed the homeless. And they came to us as a BIA, but it's making sure that we're following all proper protocol and we're giving them the proper feedback, because they've asked us permission to do so, but I didn't think it would be appropriate based on COVID-19 with social distancing. And then of course, as well, food handlers, who has that, who doesn't, if they're touching any food, it needs to be packaged properly and handing it over. It just, to me, there's so much. So that's why I thought that would be another question I needed to ask today. But I will follow up with our local Board of Health, that it just, you just kind of gave me the nod to, yeah, there's more.
Totally, and it's not the first request we've had for this kind of an idea. I have worked with some Optimist clubs to do takeout only options for fundraisers where they pre-order. Yeah, get in touch with your public health inspector. There's just a lot of nuance in that and a lot of different questions that would apply very specific to this very specific event. Even outside of COVID, if you're providing food to the public, you do have to fill out a special event notification form with us, and a health inspector follows up with you guys to make sure you're doing it all properly, and that it meets up with food premises regulations anyways. So I'll get you her contact information and get you in touch with her, because she works very specifically. Health inspectors, we're all kind of divvied up geographically. So I'll get you her contact information so she can give you a more dedicated follow-up.
Perfect. Appreciate that. Thank you.
Okay, I have one question. It's for the future, and I'm not sure if you can even answer this. Dr. Lock, do you think it's going to be possible in November for gatherings for a sit-down dinner of more than 300 people, or is that farther into like 2021? We have a big signature event every year in November that is a sit-down dinner. And our committee is doing planning, and we may have to try and come up with a new avenue for it.
So 400 people in November, I think it's highly unlikely.
Okay.
Bottom line. Yeah. I'm actually, I think we're going to be opening up over the summer. And then in the fall would be the big challenge about whether we open up schools. I think there will be a real desire and interest to open up schools. And then we're going to have to see what that does. So the fall is going to be a tricky period of time. I think we'll be as bold as trying to open up schools. I don't think we'll be as bold as opening up 400-person other events.
Okay. We don't know if people would even come, but thought we'd ask the question and then we can make our changes right away. So, okay.
Can I just add to that, Kim, before we go? It's Suzanne. So we're in the same vent as Kim, Dr. Lock. I mean, she went up to 400. Is your answer supposedly the same for about 250?
I would say yes.
That's what I thought. Okay, thank you.
Right now we're still at 5, and it's high, and our numbers are as low as they are. We're going to open up, and there'll be a slight creep in our numbers going up. So we haven't even gotten to 10 yet.
Yeah. Okay. All right. Nope. That's fair enough, and that's good. So we can move forward with our plans then. So that helps us a great deal. I really appreciate you, and so does the Woodstock or the Tillsonburg and Ingersoll Chamber, taking the time to be with us today. It's really helpful. We have recorded this, so we can play this on our social media. And thank you very much for coming today and answering all our questions and helping us out.
Thank you, and we look forward to working with you more.
Thank you.
Thank you.